Today we are going to discuss jaundice means high levels of bilirubin, and when high levels of bilirubin circulate the body, they tend to deposit in the skin, mucous membrane and sclera of the eye, which leads to the characteristic yellow appearance of these tissues. The clinical term of high circulating levels of bilirubin is known as hyperbilirubinemia. When bilirubin level exceeds 34.2 micromoles per liter, we start having these clinical appearances of the yellowing of these tissues. So what is bilirubin? Bilirubin is a fluid found a fluid made by the liver. And bilirubin is a breakdown product of heme metabolism. The bilirubin metabolism begins with the red blood cells, which have a lifespan of approximately 120 days. And after they complete their life cycle, they are destroyed in organs like spleen and liver, which contains numerous macrophages. So it releases the hemoglobin within the red blood cells. So in RBC lysis, then hemoglobin is split into the heme component. Here you can see this chart. And globin part. Heme is the iron and the globin is the protein component. Globin is further converted into amino acids and utilized in the body. Is then converted into the iron and the bilirubin. And this reaction is catalyzed by the enzyme oxygenase. In the next step, the biliverdin is converted into bilirubin. And this reaction is catalyzed by the enzyme biliverdin reductase. And this bilirubin so formed is it in the unconjugated form, which is not the soluble form. That is, it is lipid soluble. So it requires albumin for its transport to the liver. And in the liver, the bilirubin is converted into the conjugated form, which is the water soluble form. So unconjugated bilirubin is water is not the water soluble form, and conjugated is water soluble form. And this reaction takes place by the combination of glucuronic acid with unconjugated bilirubin. And at this point, the conjugated bilirubin is secreted out and drains into the bile ducts and is sent to the gallbladder for the storage as bile. So when you eat something, your gallbladder secretes the bile which has the conjugated bilirubin in it, and it moves through the common bile duct to the duodenum, the small intestine, and is converted into urobilinogen by intestinal microbes. The bilirubin is acted upon by number of microorganisms and is converted into urobilinogen and stercobilinogen. And majority of these compounds are excreted in the feces in the form of stercobilin. The stercobilin which gives the yellow color to the feces. But 10 to 15% of these compounds are reabsorbed into the blood, and some part of that reaches the liver, and this is known as the enterohepatic circulation. A few percentage of the reabsorbed compounds reach the kidney and they are excreted in the urine in the form of urobilin. So this is about bilirubin metabolism. So if you have an idea about this bilirubin metabolism, it will be very easy for you to understand the disease jaundice as well as its Ayurvedic term. Okay. So this is very, very important, this bilirubin metabolism. So what causes increased bilirubin? That is the overproduction by reticuloendothelial system. That is the overproduction of heme. And next is the failure of hepatocyte uptake, anything related to liver, and failure to conjugate or excrete, and obstruction of biliary excretion into intestine. Okay. And the normal range of bilirubin, normal to have some bilirubin, uh, like that normal levels are direct bilirubin is 0 to zero point 0.3 mg per dl and total bilirubin is 0.3 to 1.9 mg per dl. And the types of jaundice. We have three types of jaundice, that is pre-hepatic jaundice, and post-hepatic jaundice. So what is pre-hepatic jaundice? Pre-hepatic jaundice, it is due to a lot of breakdown of the RBCs, which is what contains hemoglobin. So here you already seen heme and globin part. Uh, so breakdown of RBCs, which contains hemoglobin. That is why this type of jaundice is also known as hemolytic jaundice, because plasma membrane of the red blood cells are often defective or they are not strong enough. So they rupture easily and causing increased levels of hemoglobin to be released, and that is breakdown into bilirubin into the blood. And the cause of this type of jaundice can be congenital or acquired. Some examples of congenital hemolytic jaundice is sickle cell anemia, thalassemia, and any congenital deficiencies or pyruvate kinase deficiency, and erythroblastosis vitalis. And the acquired causes, it can be trauma, vitamin B12 deficiency, folic acid deficiency, infections like malaria or autoimmune hemolysis, chemicals and toxins, and hypophosphatemia, etc. And next is the hepatic. So in prehepatic, what will be more? Like unconjugated bilirubin will be more. Elevated unconjugated bilirubin will be more. For this, you have to understand that chart, bilirubin metabolism. Okay, in that first is unconjugated bilirubin, and unconjugated bilirubin is converted into later into conjugated bilirubin. So in hepatic, what in hepatic means related to liver. In this type of jaundice, there usually it is a problem with the hepatocytes of the liver. Okay, the passage of bilirubin through the liver involves bilirubin reaching the liver bound to a protein called albumin. The bilirubin in the liver is then combined with the glucuronic acid to form conjugated bilirubin. And the main enzyme involved in the conversion is here. Conversion is UDP glucuronyl transferase. And then it is excreted from the liver in the form of conjugated bilirubin. So any difference which affects the affects the uptake of bilirubin in the liver or the conversion into this conjugated bilirubin. This is as hepatic jaundice because it is happening in the liver. And if there is also an issue with the excretion of bilirubin, this is also considered within the same classification of hepatic jaundice because it will lead to accumulation of bilirubin. So there is three mechanisms involving the excretion of bilirubin, and they are bile acid dependent, bile acid independent secretion, and also bile ductular secretion. And we'll see what are the congenital causes of hepatic Wilson's disease, Gilbert syndrome, etc. And the acquired causes can be viral hepatitis, alcohol hepatitis, sepsis, malnutrition, trauma, and hepatic adenomas. And the third one is, so in uh, hepatic, there will be both conjugated and unconjugated bilirubin will be there. Okay. And in post-hepatic, the cause of jaundice due to the biliary infection of the hepatobiliary system. Main cause of post-hepatic jaundice is obstruction. This is the obstructive jaundice. And the congenital causes of this type of jaundice biliary atresia, pancreatic biliary malfunction, etc. And the acquired causes can be encephalitis, trauma, pancreatitis, tumors, gallbladders, intra-abdominal tuberculosis, etc. So the symptoms of post-hepatic jaundice can include thick stools, abdominal pain, dark urine, etc. That we will see in the next slide. So three types of jaundice is prehepatic or hemolytic jaundice, hepatic or hepatocellular jaundice, and the post-hepatic or cholestatic or obstructive jaundice. So here is the urine color, which I said in prehepatic the urine color will be normal. In hepatic it will be dark, in post-hepatic it will be dark. Why? Because in hepatic it is dark, because in post prehepatic we said it is unconjugated bilirubin. In serum you can see the unconjugated bilirubin will be there, and in hepatic both unconjugated and conjugated bilirubin, and in post-hepatic the conjugated bilirubin will be more. So already okay. So in prehepatic jaundice, the urine color will be normal, and in hepatic it will be dark, and in post-hepatic it will be dark. Why it is in hepatic and post-hepatic it is dark? We already said that in prehepatic there will be unconjugated bilirubin, right? And in hepatic, both conjugated and unconjugated. And in post-hepatic, it will be conjugated bilirubin will be there. So, and already in bilirubin mechanism, we discussed that the conjugated bilirubin is water soluble. So that is why in hepatic and post-hepatic, the urine color will be dark in color. Okay. The stool color in prehepatic normal, and in hepatic also normal, and in post-hepatic it is acholic. Acholic means it is pale color or clay colored. Okay. In obstructive jaundice, and then you can see this. Pruritus, itching. Itching will be in prehepatic there will be no pruritus, and the hepatic it is no itching, and in post-hepatic it will be present. And this is the third type, post-hepatic or obstructive jaundice. There will be obstruction. And other types of jaundice is also there. That is pathologic jaundice. Pathologic jaundice, it can occur in children and adults and is diagnosed when jaundice presents a health risk. And several forms of hepatitis, cirrhosis of the liver, and other liver diseases, and bile duct blockage, along with injections and medications that can also cause pathological jaundice. And the Gilbert syndrome jaundice. Gilbert's Gilbert syndrome, that is also an autosomal dominant It will be more in males and benign but chronic disorder, and that is also characterized by mild, persistent, unconjugated hyperbilirubinemia, which is due to defect in hepatic uptake of conjugated bilirubin due to deficiency of bilirubin glucuronine transferase enzyme. I hope you remember when we discussed the bilirubin metabolism. And the neonatal jaundice. The symptoms of neonatal jaundice could be poor feeding, lethargy, changes in muscle tone, high pitched crying, seizures, etc. The causes of jaundice. Too much bilirubin is produced for the liver to remove from the blood. For example, hemolytic anemia. That is, we said about the prehepatic jaundice. And next is a defect in the liver. That means hepatic. That prevents bilirubin from being removed from the blood, converted to bilirubin or glucuronic acid. That is conjugated. And the next cause you can guess, that is the obstructive cause. That is blockage of the bile ducts. That decreases the flow of bile and bilirubin from the liver into the intestines. So these are the causes: prehepatic, hepatic, and obstructive. And what are the common signs and symptoms of jaundice? That is yellowish discoloration in the skin and mucous membrane, and the white eyes, whitish eyes, and also the uh, light color stools, and also the yellowish discoloration of the eyes. That is called icterus. And light color stools, dark color urine, itching of the skin, and that we said it will be present obstructive jaundice, post-hepatic jaundice. Nausea and vomiting, abdominal pain, fever, weakness, loss of appetite, headache, confusion, swelling of the legs and abdomen. And the diagnosis of hello, hello,
Hello?
audible, no, doctor?
Yeah.
Okay. It is a blood test, bilirubin test, that is liver function test, and also CBC you can check to check for low blood count, and the in later stages abdominal ultrasound or abdominal CT you can take, liver biopsy, and cholesterol level also you can check, and the prothrombin type. This is the diagnosis of jaundice. And the table of this test, it will be useful for clinics like prehepatic when it is prehepatic jaundice, and it will be hepatic jaundice, and the post hepatic jaundice criteria. So this will be in your notes, it will be there. So this chart you have to learn. And the jaundice treatments. The treatment may consist of expectant management, that is mainly rest, and the medical treatment with IV fluids, medications, antibiotics, or blood transfusions if it is required. And if a drug or toxin is the cause of this jaundice, it should be discontinued. And in certain cases, in case of newborn jaundice, the exposing the baby to special colored lights, that is the phototherapy or exchange blood transfusions if it may be required. Okay. And the surgical treatments if it is required in obstructive jaundice. And the main treatment is rest and the proper diet regimens. So this is about jaundice. So to summarize, the prehepatic jaundice, which is mainly caused due to hemolysis or the splitting of blood cells because they are not strong enough. And the hepatic jaundice, which affects the introduction of bilirubin to the liver, the conversion to unconjugated bilirubin, and the excretion. In the post hepatic jaundice, there is some kind of obstruction in the biliary portion of the hepatobiliary system. So these are the three types. Then next we'll move to the clinical aspects. So when a patient complains of yellow discoloration of eyes or skin, first find out whether it is due to hyperbilirubinemia or keratinoderma. So hyperbilirubinemia already I explained. And if it is due to hyperbilirubinemia, then the next step is to find out whether it is due to prehepatic or hemolytic jaundice. And next is hepatic or hepatocellular jaundice, and the cholestatic or obstructive jaundice. So when a patient comes with this yellowish coloration of eyes and skin, first find out whether it is due to hyperbilirubinemia or carotenoderma. If it is due to hyperbilirubinemia, then we have to find it as hepatic, prehepatic, hepatic, or post-hepatic jaundice. And what is carotenoderma? It is a yellowish color of skin is by the presence of carotene due to indigestion of excessive amount of vegetables and fruits that contain carotene, uh, such as carrots, leafy vegetables, orange, peaches, etc. And the yellow color is concentrated on palms, soles, forehead, and nasolabial fold. And the sclera is not yellow. And the other causes of yellow discoloration of skin are the drug quinacrine that can color skin and sclera, and the excessive exposure to phenols that can also color the skin yellow. Okay. And we have to see for the various signs, some symptoms of each jaundice. The first one is the hemolytic jaundice. So the features are lemon yellow color of the eyes, presence of anemia, and due to overproduction of bilirubin, hemolysis will be the normal color of urine in presence of splenomegaly, in the positive family history or similar previous attacks. And the causes are already we said inherited and acquired causes. And the causes of non-hemolytic unconjugated hyperbilirubinemia, that is decreased hepatic intake, and also drugs like rifampicin, etc., can cause. And the causes of hepatocellular jaundice, the dark yellow color of eyes, and the urine is tea colored or cola colored, that we already mentioned, dark color urine. And the pruritus, it is present, and malaise, anorexia, low grade fever, abdominal pain will be there, and slow onset and slow recovery. And causes we already mentioned. And the features of obstructive jaundice, that is the orange yellow color of eyes, clay colored stools, pruritus, dark urine, pain occurs in stone carcinoma, uh, and features of malabsorption in later stages, you can see that, and due to regurgitation of bile from damaged hepatocytes or bile duct. And the causes we already explained. And the mode of inquiry to patients. In the history of presenting complaints, you have to mention age and sex. Why? Because Infective hepatitis, it is common in young adults. And congenital hemolytic anemia manifests in young age. This, if you want, you can note it down. And the common duct stone and neoplastic jaundice in middle-aged or elderly. And the portal cirrhosis, primary cancer of liver, and pancreatic cancer, it is predominant in males. And the common dextrone, primary biliary cirrhosis, and carcinoma of the gallbladder are common in the females. So that is why age and sex is important. And the duration of the illness. So if a patient comes to you with uh, jaundice, then you have to, in your key sheet, these things you have to include. Okay, the duration of the illness. So prolonged history of jaundice suggests chronic liver disease, cirrhosis, or malignancy. And short history, infective hepatitis and drug or toxin induced injury. And the recurrent episodes occur in hemolytic jaundice and Gilbert's and other inherited causes. And next is the, we explain duration, and next is the mode of onset. Rapidly developing jaundice with preceding nausea and vomiting. Okay, next is mode of onset. Rapidly developing jaundice with preceding nausea and vomiting suggests infective hepatitis. Persistent, mild, fluctuating, and recurrent jaundice, it suggests hemolytic anemia, Gilbert's disease, and Wilson's disease. And the obstructive jaundice develops slowly. So this is also the mode of onset is also very important. And next clinical aspect is ask for the specific symptoms suggestive of liver disease. Liver specific symptoms are jaundice, dark urine, light stools, itching, abdominal pain, and bloating. And also ask, does the patient have fatigue in the afternoon or in the morning? Fatigue in liver disease is after activity or exercise. Why? It is rare in the morning after adequate rest. And it is intermittent and variable in severity from hour to hour. And jaundice more after fasting and stress that it suggests Gilbert's disease. Okay. So we explained age and sex, duration of illness, mode of onset. And next is the color of urine and stools. Already we discussed in that table. So normal color of urine you can see in which jaundice? Hemolytic jaundice. And dark in cholestatic jaundice, that is the obstructive jaundice. Brown stools in the presence of deep jaundice or the parenchymal diseases. The clay colored stools, common bile duct stone. And the next symptom is the fever. A fever with rigor and chills and right-sided abdominal pain, it suggests cholangitis, liver abscess, and malaria. And fever with severe myalgia and conjunctival congestion, it suggests leptospirosis. And recurrent fever suggests cholelithiasis. And next symptom is the abdominal pain. If abdominal pain is there, uh, then the abdominal pain, clay colored stools, and itching. It suggests obstructive jaundice. And right heart failure, pain due to hepatic congestion, and cholestasis. And right upper quadrant discomfort or liver pain. or the aching type of aching type. It is due to the stretching of the capsule occur in hepatitis. That is a rich in that which is rich in nerve endings. So it occur in hepatitis. And severe pain suggests gallbladder disease, liver abscess, severe veno-occlusive disease, and recurrent abdominal pain you can see in cholelithiasis. Okay. And next symptom is itching. Itching, it is a chronic, it is the presenting symptom in chronic liver disease with cholestasis, such as primary biliary cirrhosis and sclerosing cholangitis, and it occurs before jaundice. And it can occur in any liver disease. And nausea and vomiting. Nausea provoked by eating fatty food and some order of food, that is in hepatitis. And weight loss, if weight loss is there, it suggests malignancy and chronic liver disease. And ask for risk factors for liver disease, that is such as occupation of the patient. Uh, because farm and sewage workers are at high risk of leptospirosis. And also ask the history of intravenous drug abuse, recent injections, homosexuals, or any tattooing that suggests of hepatitis B infection. And the history of travel to areas with hepatitis risk, that is exposure to contaminated food, and drugs taken particularly in the previous 2 to 3 months also you have to ask. And the consumption of shellfish, why it suggests hepatitis A infection, because the main cause is due to the exposure to contaminated food. So the shellfish also it suggests of hepatitis A infection. And the alcohol consumption, it suggests of alcoholic hepatitis and cirrhosis of liver. And also history of ulcerative colitis. If that history is there, then it can predispose to sclerosing cholangitis. And next is the past history of the patient. So any history of like blood transfusion, because hepatitis B and C infection. Hepatitis B is a blood-borne infection. Okay. And drugs also. Any whether the patient had taken any drugs, and any history of recurrent jaundice, and also the any history of surgery and contact with persons with jaundice, and the any accidental exposure to needle or in blood, and the abdominal pain also you have to ask. This is the past history. And next is the family history. Any family history, any of the family members are having Gilbert's disease, or the inherited hemolytic anemia, Wilson's disease, history of cirrhosis, diabetes, or endocrine failure, and the appearance of liver disease in adulthood. And next is the personal history of the patient. Whether the patient traveled to any high risk areas, any contact with the jaundice patients, and the intake of alcohol, that suggests of alcoholic hepatitis and cirrhosis. Because greater than 2 drinks, that is approximately 22 to 30 gram per day in males, and 3 drinks in females for at least 10 years. So the alcoholic intake also you have to ask. And the occupation of the patient, and their any IV abuses there, that questions you have to ask. So this is regarding the case taking of the jaundice case taking. And next we'll move to Ayurvedic part. So, Ayurveda, it is Kamala. Kamala is a systemic disease which represents sickness of liver, that is yekrit. It may be due to impaired reticular endothelial system or hepatobiliary system of digestive system. And Ayurveda explain yekrit as a part of Raktavaha Srotas. So these are the references of disease Kamala. It is in Charaka Chikilsa 16th chapter. That is the Panduroga, Pandu Chikilsa. After Pandu Chikilsa, Kamala is explained. And also in Sushruta Uttarasthana, 44th chapter. And also in Ashtanga Hridaya Nidana, 12th chapter. And in Ashtanga Hridaya Chikilsa, 16th chapter. And also in Madhava Nidana, 8th chapter. So what is the derivation of Kamala? Kama plus la, Kamala. That is absence of kama or absence of desire for food. And one more derivation is that is kulsita plus mala. That is Kamala. Kulsita plus mala. That is the accumulation of excess mala that are toxins. So next we'll see the description of the disease Kamala. So the term Panduroga, so you can refer the shloka from Charaka Chikilsa, 16th chapter, 34th shloka. So it starts with Pandurogi tu yu atyartam pittalani nishevate. So the term Panduroga in this context of pathogenesis of Kamala, it implies that the disease Kamala, it just represents a state of Panduroga associated with specific etiological factors. So in Harita Samhita, he accepts Kamala, etc., just as a part of Panduroga. And according to Harita, Panduroga is of 8 types. That is Vata, Pitta, Kaba, Sannipada, Mladbhakshnajanya, Kamala, and Halimaka. Kamala and Halimaka are types of types of Kamala, sorry, types of Panduroga according to Harita Samhita. Okay, total 8 types he mentioned. And the Kamala that is explained in Sushruta Uttarasthana also, 44 chapter is explained, that is a different entity. According to Sushruta, at the end of Panduroga or any other disease, if a patient all of a sudden indulges in amla rasa or any pittagara ahara vihara, his pitta gets aggravated and his face it will become pale yellow color and also causes drowsiness and emaciation. And according to Vagbata, in Ashtanga Hridaya also, Kamala that is caused by aggravated pitta, it may occur with or without Pandaroga. And a simile also Acharya has mentioned, like how it is, like you already studied that about Prameha Pidakas. Prameha Pidakas, it may occur with or without Prameha. So, similarly, the Kamala, it may occur with or even without Pandaroga. So, from this, you will get two things how Kamala occurs. That is, one is either the Pandarogi, if he indulges in Pittavardhaka Ahara Vihara, or if a person directly involves in the excess consumption of Pittavardhana Ahara Vihara. So these are the two chances. So this is the Nidana which I explained now. And here So the Pandurogi tu yu atyartam pittalani nishevade. Tasya pittamasrat mamsam daktva rogaya kalpade. So here it is, if the patient suffering from Pandu indulges in pitta aggravating diet and regimens, then the pitta so aggravated burns the rakta and mamsa to cause the disease kamala. So here Acharya has mentioned the word, a technical term, it is dakta. So which are the dhatus involved? Mamsa and rakta. It will cause the dakta. That means it is burns. So the dhatus which will become dakta due to pitta in kamala. Okay. And next, it is the lakshana of Pandurok. Sorry, kamala. That is the Haridra Netra Sabhrisham Haridra Twang Naghanana Raktapida Shakranmutro Bekhavarna Hadendriya Daha Vibhaga Daurbalya Sadana Aruchi Karshida Kamala Bahupittisha Koshta Shakashrayamaga. That is the types. So the first two lines that is explains the signs and symptoms. That is the Haridra Netra. That is the eyes, skin, nail and face of the patient becomes exceedingly yellow in color. And his blood and urine also become red and yellow in color. And next is the Bekhavarna. Bekhavarna means the complexion of the patient resembling that of the frog. And this is an important question if you are preparing for entrance exams. This question may come. Bekhavarna is the Lakshana of which disease? It is the Kamala. It is an important question for PG entrance. And Hadendriya. Hadendriya means sluggishness of the sensory functions. And Daha, it is the burning sensation. Avipaka, indigestion. Daurbalya, weakness. Sadhana means loss of function. Aruchi, loss of taste. And Karshida, emaciation. And the types. Types both Koshta Shakashraya and Shakashraya types. If associated with excess of Pitta, then Koshta Shakashraya. And if it is only Shakashraya type, then which is associated with less or aggravated Pitta. And the term here, the Bahu Pitta in Shloka, if you refer Shloka, in the last line, Kamala Bahu Pittesha Koshta Shakashraya Mada. The 36th shloka, the same chapter, 16th Charaka Chikitsa, 16th chapter. In that Bahupittesha means Bahupitta, that implies that it is only in Koshta Shakashrita Kamala. And the Pitta, it is aggravated in excess, and in Shakashrita Kamala, Pitta is less aggravated. So if Koshta Shakashrita Kamala means, if Kamala means it is Koshta Shakashrita Kamala. Kamala implies Koshta Shakashrita Kamala. Okay. Shakashraya is different entity. Okay. That will explain later. So all these signs and symptoms are, which explained us, are the signs and symptoms of Koshta Shakashraya Kamala. This Haridra Netra. What explained Haridra Netra, Sabrisham, Haridra Tung Netra Naghanana. All these symptoms are the symptom of Koshta Shakashraya. And the general treatment. Kamalayam tu Pittagnam Pandurogi Avirodi. That is from Ashtanga Hridaya. And also from Charaka Chikilsa 16th chapter 39th shloka. Tatra Pandvamayi Snigdha Tikshnair Rudha Anulomikaihi Samshodhyo Mrudubhistiktai and Kamalitu Virechane. So the first which I explained as the treatment of Panduroga, and for Kamala, a patient suffering from Kamala should be given purgation therapy, Virejana. That is Kamalitu Virechani. In that shloka, the first two lines are the treatment of Panduroga. The next Mridubhistikte Kamalitu Virechani. That is, it starts from Kamala Chikilsa. Okay. So the patient suffering from Kamala should be given Virechana with mild and bitter drugs. That is Mridubhistiktai. Mridu and Tikta Dravyas. So what is the property of Tikta? Why it is Tikta Dravyas are included? It is basically Pitta doshas. So you can, starting from your Sutrasthana, you have to refer. Tatradya Marutam Granthi, that shloka. It is Pittahara. And after the Koshta Shuddhi, all the elimination therapies, both, and this type of patient should be given wholesome food containing Purana Shali, Yava, and also Goduma with the Yusha, and also with the Yusha of Mudga Yusha, Adhaki, Masura, and the Rasa of um, Jangala Mamsa, etc. you can give. And on the basis of the doshas activated to cause these disease, specific medicines are to be administered to these two categories of patients. And for the purpose of Snehana, the patient suffering from Pandu and Kamala should be given Panchagavya Krita, Mahatiktaka Krita, Kalyanaka Krita, etc. Here also you have to focus on where the Grita should be started. That should be taken from Jwara Chikitsa. In last class also I had mentioned the same thing, that we have to start the Sneha or any Sneha. The condition of the patient should be Kafe Mande Vada Pittotare. The Kapha is in Shinavastha and should be Vada, and Pitta should be in increased state. That is Kafe Mande Vada Pittotare. That you can refer the Charaka Chikilsa Jwara Dhyaya, Jwara Chikilsa you can mention. There it is mentioned. So here also it is that is applicable. Okay. And also some Shamana Ushadis it is mentioned Atakata and plus Trikadu in Vilva Matra dose, and also Nikumpa Kalka and plus 2 times Kuda plus Shadavari and Kumpasya Churnam plus Shaudran plus Tripalarasa, and also Kamalabaha Anchanam, that is Nishagairika and Datri. And here the Nikumba Kalpa means it is Nagadandi. Okay. And Kumbha means it is Trivrit. Kumbhasya Churna means Trivrit. And the yogas mentioned are Drakshakritam, Haridradikritam. In that it is mentioned Kamalaharam Uttama. And Vasa, it is commonly used in clinics. That's Vasha Kulujyadi Kashayam and Navayasa Churnam, Yogarajam. In that yoga also it is Rasayanam Midam Shreshtam Sarvarogaharam Shiva. Also Shilajadovaka. These are the various formulations you can use in Kamala. This is the general treatment for Kamala. And next we'll see the various types of Kamala. So first we are discussing about the Kumbha Kamala. Here we will mention about Kumbha Kamala, Shakashraya Kamala, and Halimaka. Okay. So Kumbha Kamala means it is a chronicity. It shows the chronicity of the disease Kamala. Is slides visible? Hello? Hello?
Yeah, doctor, it's visible.
Okay. So Kalantarat Karibhuta Krishna Syat Kumbha Kamala. That is the Kamala if it becomes deep seated. Karibhuta means it is deep seated or it is hardened. That which shows the chronicity of the disease Kamala. And it becomes difficult to cure. This Kumbha Kamala is difficult to cure. And this it is called Kumbha Kamala. And the signs and symptoms of Kumbha Kamala. And also one more thing in the Kumbha, the term Kumbha means according to Chakrapani commentary, it is Koshta. Okay. So the term Kumbha Kamala, it is the advanced stage of Koshta Shakashrata Kamala. And this Kumbha, it is a synonym for Koshta. And the Kamala, which is located in the Koshta, is called Kumbha Kamala. You can see a reference in Chakrapani. And the Lakshanas of Kumbha Kamala. Krishna Pida Shakrin Mutro Brisham Shunasya Manava Sa Rekta Akshi Mugacharti Vin Mutro Yasya Tamyadi Daha Aruji Trisha Anaha Tantra Moha Samanvida Nashta Agni Sanya Shipram Hi Kamalavan Vibhatyate. So Krishna Pita Shakran Mutra means dark yellow colored feces and urine. And Brisha Shuna means sudden edema. And Raktakshi Muga Charti Mutra, reddishness of eyes, face, vomitus, and urine. Dhamyadi means associated with fainting. Daha means burning sensation. Aruji, loss of taste. And Trisha means thirst. Krishna. Anaha, it is the obstruction of Koshta either due to Ama or Shagrat resulting in reversal movement of Vayu. And Tantra, Moha, drowsiness and altered sensations. And Nashtagni means loss of digestive fire. And this is very difficult to cure. And that is why the Asadhya Lakshanas of Kumbha Kamala, Chardi, Kumbhakamala associated with Archardi, Arochaka, Pralasa, Jwara, and Klama, that is considered as incurable. And it is references Charaka Chikitsa 16 bar 139. It is Chardi, Arojaka, Hrillasa, Jwara, Klama, Nipitita, Nashyadi, Shwasa, Kasartho, Vidbidi, Kumbhakamali. So next is the treatment for Kumbhakamala. The treatment which is applicable to Kamala, that is also applicable in Kumbhakamala because it is a chronic stage of Koshashakashata Kamala. That is the Kamala. And also specific medications it is mentioned are Karmada plus Gomutra for 1 month and also Makshigam or Hiranyajim or Purana Kitta for 1 month. And next terminology is it is the Ruddhapada Kamala. So Ruddhapada Kamala means there is one obstruction. There should not be any physiological, any pathological or any physiological change will be there. And there will be no change in the process or anything, but there will be an obstruction will be there. So a patient of Kamala, if passes stools of the color of sesame paste, that is Tilapishtanibam, then it denotes obstruction in the passage of Pitta by the Kapha. Usually the obstruction will cause due to Kapha dosha. So that is a Ruddhapada Kamala. That is if any obstruction caused. If any obstruction is there, then that is the that is the Tilapishta, Ruddhapada Kamala. That is Tilapishtanipamyastu Varsha Srijati Kamali. And because of the obstruction to the bile passage by Khabha, the pitta in the periphery does not flow into the koshta, thus causing excess of pitta in the shaka. Okay. And next is the treatment of Ruddhapada Kamala. It is here there is the pathology is the obstruction. So we have to do the Kafahara Kriya. Okay. And next is the Shakashraya Kamala. So Shakashraya Kamala, the Nidanas are Ruksha, Shida, Guru, Swatu, Vyayamar, Vega Nigrahai. And the pathology is like Kapha Sammurshito Vayu Sthanat Pittam Kshibed Bali. So since the Pitta which imparts color to that is the Lakshana, we'll come to that. So these are if you see the Nidanas, you can see it is caused due to the dosha, Vata dosha, right? In Ruddhapada Kamala, the main dosha was Kabha dosha. The obstruction was due to Kabha. And here it is, if you see the Nidanas, it is almost Vatakara Nidanas. Like Ruksha, Shida, Swadu, or the Vyayama, Vegandaharanam, all these things. And that leads to Vata and Kapha Sammurshita. So Vata and Kapha and Bahikshibet in Shakashraya the pitta will move from koshta to shaka. And the pitta, uh, like here, because of the obstruction to this passage, the pitta in the shaka does not flow to koshta, and this causing excess pitta in the shaka. This is the pitta which imparts color to the stool. That pitta which gives the color to the stool, that is not available in the, that is which pitta, Ranjaka pitta. It is not available in the koshta, and the patient was white colored stool, Shveta Varshas. That is the main characteristic features of Shakashrita Kamala. Okay, so here in Shakashrita, the Pitta, it will move from Koshta to Shaka. The word Acharya used is Pittam Bahikshibed. And next is so here in this, the main thing is the doshas are Vada and Kapha, and the color of Varshas is Shveta Varshas. And in Rudrapada Kamala, we had seen it as Tilapishta, and here it is Shveta Varshas. And the symptoms are Haridra, Netra, Mutra, Tvak, Shveta Varshas Tadanara. And the Netra, Mutra, Tvak, it will be Haridra Varna. And due to this outward movement of Pitta from Koshta, the symptoms you can see the all this digestive problem you can see, or due to Agnimantia, you can see the Atopa, Vishtamba, Guruna Hridaya, Alpagni, Aruchi, Jwara, Pashwarti, and Shwasa, Hitma. All these symptoms you can see. That is a symptom of Shakashrita Kamala. Okay. And the treatment for Shakashrita Kamala, that is बर्हि तित्तिरि दक्षाणां रूक्षाम्लै कटुकैरसै शुष्कमूलककोलत्तै यूषैश्चान्नानि भोजयेत्. And मातुलङ्गरसं क्षौद्र पिप्पली मरीचान्वितं स नागरं पिबेत् पित्तं तदा अस्येति स्वमाश. That is, the patient suffering from Shakashrita Kamala should be given food along with the soup of meat of barhi, titiri, and all those type of birds. And that is with Annanctus, Ruksha Amla Kadugai Rasa, along with Ruksha Amla Kadurasa. And also the vegetable soups, or also the yushas of dry radish, that is the Mulaka and Kulatta. And patient also should be given the juice of Madhulunga mixed with Madhu, Pipali, Marija, and Shundi in order to bring Pitta to its own course. And next is the duration of the treatment. And the Kadu, Tikshna, Ushna, Lavana, and extremely Amla rasa drugs should be continued. Till when? Till the stool of the patient acquires the color of Pitta and the Vata gets alleviated. Till that, we have to do the treatment. And after this treatment, if the stool acquires the color of Pitta or the normal color of Mala, then after that we have to do the normal the Samanya Kamala Chikilsa. That is the Koshta Shakashraya
Kamala chikitsa we have to do. Okay, so till the stool appears the normal color, we have to do the treatment of Shakashraya Kamala, and after that we have to follow with uh, normal Samanya Kamala chikitsa. So next is Halimaka. Halimaka symptoms are Lodhara and Alasa. Here the dosha is Vata and Pitta. So the dosha which is seen in Ruttapada Kamala is mainly Kapha dosha, and in like in Shakashraya that was Vata and Kapha dosha. Uh, and here in Halimaka the dosha is very important. It is Vata Pitta. That also for your entrance examinations it may ask. Dosha is Vata Pitta in Halimaka, and it is considered as Mahavyati. And here the color of the patient, it is based on the color of the patient. And if the color of the patient suffering from Panduroga, if it becomes Harita or Shava or Pita Varna, that is green, black or yellow, and he suffers from the weakness, loss of enthusiasm, drowsiness, and the Agni or the Jwara, Mridu Jwara, and lack of libido, that is Trishu Harsham, all these things, uh, and also the Angamarta, Shwasa, Trishna, Aruchi, Brahma, then it is the disease Halimaka, that is caused by aggravation of Vayu and Vata and Pitta. And this the shloka is like Yadatu Pandur Varna Syad Harita Shava Pitaka Balolsaha Kshayastandra Mandagnitvam Mridujwara Trishu Aharsham Angamardasya Shwasa Trishna Arujir Brahma Halimagam Tada Yasya Vidyat Anila Pittata. And this is also an important question for entrance examinations, that is Strishu Aharsham. Strishu Aharsham, that is the feature of Halimaka. And not only in Halimaka, you can see this feature in Kabaja Grahani also. And in both this, you can see Strishu Aharsham. It's an important question for your entrance exam. And next is the Chikilsa of Halimaka. And the patient suffering from Halimaka should take the like the combination prepared of grida, like Mahisha grida, by adding the juice of Guduchi, Guduchi Swarasa, and also the Shira. And next is the Virechana. So after Snehana, the patient should take Trivrit mixed with the Amalaki Rasa or the Tatri Rasa along with Trivrit. So a Trivrit mixed with the Tatri Rasa, that causes Virechana. Thereafter, he should take the diet and regimens which are dominated by Madhura Rasa, that are the like that which alleviate Pitta and Vayu. And also you can do Yapana Vasti, like different types of Yapana Vasti, Shira Vasti, Anuvasana Vasti, etc. And he should also take different arishtas, that is prepared of like different arishtas like Draksha Arishta, etc. That is for Agni Dipti. And also Abhayavaleha, that is the Agastya Haritaki. that which is described in the Kasa Chikitsa, that also you can use. And also the Dhatri Avaleha in a dose of, the dose explained as Panitala Matra. So this is about Kamala. So just I will summarize the whole topic. First we discussed about jaundice. And jaundice, it's so first we discussed about the jaundice. So first I said what is jaundice? It is a high levels of bilirubin. And next we said what is bilirubin, and we explained what is bilirubin mechanism, bilirubin mechanism, the bilirubin metabolism. In that we had seen in hemolysis, like in RBC lysis, so there are two parts. One is heme part and one is globin part. And the next is the heme part. That is it which is and the first one is and
Hello, ma'am.
hello.
It's like breaking in your voice.
Hello.
Now it's okay.
Hello. Hello.
Hello, ma'am. There is some breaking in your voice. Now it's
Hello.
okay.
Now.
Continue.
Okay. Now.
Hello. Ma'am, you can
Hello.
continue now.
Okay. Okay. So this is just a summary. The summary, first we explain what is jaundice. Jaundice is the increased bilirubin level. We explain what is bilirubin. It is a breakdown product of heme. And next we explained about the bilirubin metabolism. And in bilirubin, in RBC lysis, we heme part and globin part. And the heme part, it will converted into, it is converted into iron, and the biliverdin, and the next step it is converted into the biliverdin is converted into bilirubin. And the first step, it is in the initial state, it will be unconjugated form, and the unconjugated bilirubin is converted into bilirubin. So since we, and at the end the production of will be stercobilinogen and urobilinogen. And next we discussed about the three types of jaundice, which are the prehepatic jaundice, hepatic jaundice, and the post-hepatic jaundice. And the diseases comes under also we explain, like in prehepatic, the hemolytic jaundice, and the hepatocellular, and post-hepatic jaundice, that is the obstructive jaundice. And next, then we discussed about the clinical aspects, what things we have to assess in patients. And next, the Ayurvedic part, that is the Kamala. So Kamala, in that if there are two chances for the disease Kamala, that is one is if the if he consumes more, if he indulges in Pittakarahara Vihara. And also one more chance, it is if the if not the Pandarogi, the Pandarogi, sorry, not the Pandarogi, if the person indulges in excessive Pittakarahara Vihara, then also the person may ends in Kamala Roga. So, and also the according to Harita, it is a Pandaroga, it is a part of Pandaroga. And according to Harita, there are 8 types of Pandaroga. Among them, 2 are Kamala and Halima. Okay. And next, and the Kamala means it is Koshta Shakashraya Kamala. Or the Koshtashraya Kamala. The types are Koshta Shakashraya Kamala and Shakashraya Kamala. And the first one is the general Kamala, means it is Koshta Shakashraya.
Lakshanas also we explain like yellowish discoloration of eyes, nose, eyes, etc., skin, etc. And next we discussed about other kamalas like Kumbha Kamala. What is Kumbha Kamala? It shows the chronicity of the disease Kamala. If it is chronic, then it is called, that is the term used is Gharibhuta. That means hardened or deep seated. That is Kumbha Kamala. That is Kumbha Kamala. And next we discussed about Vruddhapada Kamala. That is due to the obstruction due to Kapha dosha. If there is any obstruction in the Vruddha means it is Vruddha means obstruction and the Pata means passage. So if there is any obstruction to the passage, then that is called Vruddhapada Kamala. And the main dosha we had seen is Kapha dosha, and the so if the dosha is kapha, so what will be the treatment? It is Kaphahara treatment. Okay. And next is the Shakashraya Kamala. And that also we had seen, if you go through the Nidanas, most of them will be Vata predominant. So the dosha predominance is Kapha and Vata dosha. Okay. And there the main feature is the color of varchas. That will be Shveda varchas. And in Ruddhapada Kamala, it is uh, Tilapishtamika. And in Shakashraya, it is Shveda varchas. And next is the treatment also it is explained till when we have to do the treatment. If the normal color of the virtues, if the stools attained normal color, till that we have to do Shakashraya treatment. And if it attains normal color of stools, then we have to go for the Samanya Kamala Chikitsa. That is Koshta Shakashraya Kamala Chikitsa we have to do. Next we explained about Halimaka. And the synonyms also we explained Lodhara and Alasa. And also the dosha predominance is important, Vata and Pitta, and the various treatments for Halimaka. And in that the main features are also explained. Okay, so this is about jaundice and Kamala. Hello.